that not everyone was just here yet. So I think it's Dr. Harville here with Tulane Public Health, as well as Nikki Greenway, Portia Williams, Lakeisha Harris, and we have Monique Hagan and Stephanie Visco. Is that correct? And anybody else that y'all feel? Council members, a few months ago I read an article concerning the number of maternal deaths in Louisiana, and it was actually quite alarming. The Louisiana Department of Health confirmed that there were 47 maternal deaths reported between 2011 and 2016. What's more worrisome is the fact that the report found that black women were 4 times more likely than white women to experience pregnancy-related deaths. This is consistent with national trends. I've invited several organizations here who are working to change these trends in our state, and they're here. I'm going to turn it over to you. And also, I just do want to reference this report, this disparity report, and I'm assuming you all are going to reference it within your presentation, but it is absolutely remarkable. It's the health of women and girls in Louisiana and racial disparities in birth outcomes. It's very striking, the correlation between racism, structural racism, and the health impacts that we see that are manifesting in themselves within our very, very young and our black women and our mothers. So I'm going to turn it over to you. Please introduce yourselves.
Hi. We'd like to thank Councilwoman Palmer for inviting us to speak, as well as the rest of the City Council. We represent the New Orleans Maternal and Child Health Coalition, which is an advocacy group made up of over 80 individuals concerned about maternal and child health in New Orleans, and includes researchers, healthcare providers, doulas, representatives from government offices, and community organizations. My name is Emily Harville. I am Associate Professor of Epidemiology at the Tulane School of Public Health, and I'm going to provide a little bit of background about the problem that we are talking about, as well as some potential solutions. As the Councilwoman alluded to, maternal mortality has been high in this country and has been even rising. And in Louisiana, we are number 49 or number 50 in the country. And at least 50 women have died over the last few years. Our rate of maternal mortality has increased at a higher rate than the national average. And as was mentioned, black women are at between 40 and 400% increased risk of death, depending on their age. It's also important to remember that for every death, there are between 30 and 100 cases of severe maternal morbidity. So these are conditions that are potentially life-threatening or disabling, but don't necessarily end in a death. And these are not only devastating to the family, clearly, but raise costs by at least 50% for the delivery. And again, we see a disparity with black women being at least 70% more likely to experience these severe complications. It's important to note that at least half of these deaths are preventable, and also at least half of them do not occur in the delivery room. They occur at between 24 hours or up to a year postpartum. And for that reason, we're requesting establishment of postpartum home visiting. Such programs are standard in other countries and have been successfully implemented in other cities in the United States. A program like this could help with recognizing signs and symptoms that could indicate problems that are worsening, linking to care. Postpartum, many women lose their Medicaid, or they may just prioritize the care of their baby over their own health. And other kinds of care are important too. Child care, substance use, more intensive social services in some cases. Such programs also provide support for women who have chronic conditions, which often contribute to morbidity and mortality, so things like hypertension and diabetes, which can be controlled with help. A trial of home visiting in Memphis found that this was associated with reduced maternal all-cause mortality over 20 years, even though the home visiting actually occurred just around the time of the pregnancy. And it's been estimated that for every dollar invested in home visiting, the return on investment is $3 to $6. And now I'd like to pass along to other people to discuss their experiences.
Good morning, everyone. I just wanted to make clear that we wanted to make sure that all the council people heard this information because it affects all the residents in our city of New Orleans. I noticed that a few people are missing, and I want to make sure that they get this because it affects their constituency, the people that voted for them, some of which are not alive because of these statistics. So I want to make that very clear. Ms. Harville presented the numbers and disparities. I'm here to present the resources that are currently available, the barriers, and why we need more. Thank you for the opportunity to share our work that is affecting our communities and the city in which we preside over. I'm Nikki Greenaway. My community and my patients call me Nurse Nikki. I'm a board-certified family nurse practitioner and an internationally board-certified lactation consultant. I provide prenatal education and in-home postpartum medical care. The primary barrier that I'm experiencing with providing this care is reimbursement and funding. It is non-existent, and I am unable to successfully reimburse as a healthcare provider because insurance companies either don't think that the medical visit is medically necessary, or I didn't deliver the baby, therefore I cannot provide the postpartum care. And we know that only 40% of our mothers are returning for their postpartum visits. Oftentimes, my services are given away for free, but this is not sustainable for my practice as I am a mother of 3 children, I have a husband, and I'm still trying to provide for my community. I've been able to get around this a bit by contracting with organizations like Covenant House, where I provide prenatal care and postpartum care once they return home from the hospital. I work with Early Head Start prenatal programs, providing home visitation services. I've also created the Listen to Black Mothers program and the shirts that some people are wearing today, which I appreciate. 100% of the proceeds go into providing postpartum home visitation to marginalized communities. And yet I'm still missing people to treat. I am the only healthcare provider that provides these services in the state of Louisiana. Nurse Family Partnership is limited to first-time moms within a certain income bracket. T-Bears from Tulane and Healthy Start are limited in their capacity due to funding. We're all underfunded. The increasing Black maternal morbidity and mortality rates is a city problem. Our grassroots community efforts need the council's financial support. We're asking for you to fund a postpartum home visitation program that will cover all birthing people in the city of New Orleans. The particulars we can discuss. We have already met several times about this problem on local, state, and federal levels. We consistently conclude that postpartum home visits save lives. But I must remind you that meetings aren't action. We can meet on this all day. I have been to so many meetings this year about Black women dying that it's disturbing. We need programs. You and I owe it to the mothers of New Orleans to improve Black maternal health outcomes so they may survive and thrive. Thank you.
Good morning. My name is Monique Hagan. I'm the nurse advocate and doula for Birthmark Doula Collective. Thank you for inviting me here this morning and allowing me to speak on the work that we're doing. I'm going to make 3 statements that I would like you to walk away knowing after your time with me. Doulas are the answer. Doulas of color are the answer. Equitable Medicaid reimbursement for doulas is the answer. Doula care is among the most promising approaches to combating disparities in maternal health. Women receiving doula care have been found to have improved health outcomes for both themselves and their infants, including higher breastfeeding rates, fewer low birth weights, and lower rates of C-section. Birth workers of color are responding to the maternal health crisis with doula care that is reflective of the needs of families in their local communities. Solutions for mortality and morbidity in birth actually reside in the resilience of people already facing these inequities every day. At Birthmark, our doulas fight to support the community we serve. With limited funds and access to doulas of color, our community continues to suffer. We're asking our New Orleans City Council to support us in our efforts to obtain equitable Medicaid and reimbursement for doula care, with one of those keywords being equitable. Other states who have implemented doula Medicaid reimbursement, such as Oregon, Minnesota, and New York, have done so at rates that do not allow doulas to earn a living wage. Research has shown women with doula care have a 40% reduction in C-section rates, shorter labor times, and reduced use of pain medications. Savings from those resources should be used to reimburse doulas. Improve health outcomes for our community by ensuring that all pregnant individuals enrolled in Medicaid who want access to doulas will have one. We have solutions to the crisis of pregnant women of color dying in our city and our state. We're asking our New Orleans City Council to support us in our efforts and to set the example by reimbursing doula services for all employees under the city health plan. There are 3 things I asked you to remember. Doulas are the answer. Doulas of color are the answer. Equitable Medicaid reimbursements for doulas is the answer.
I want to thank you all for City Council for inviting us. I'm Lakeisha Harris. I am the Director of Reproductive Health and Justice at Women with a Vision. You know Women with a Vision. We've been on the ground for 30 years. I myself have been a doula, working for 15 years within the Black community, specifically with parents who are LGBTQ. There are different families that make up families, and for Black parents, Black mothers in particular, who are LGBTQ, we face various barriers, including accounting for our sexuality and trans people for gender. So we are at the precipice of a very important history in Louisiana. Black LGBTQ people deliver babies in unsafe and unwelcoming environments. We face discrimination held in place by laws and public policy that bar us from equity in education, employment, housing, and public accommodation, and yes, health care. Barriers are humiliated, and when carried out, are deadly for us. For 30 years, these are the family that Women with a Vision have helped to maintain life and stability. I've personally been a doula for 15 years and dedicated that time to the survival of Black LGBTQ pregnant people in healthcare systems that render their struggle in laboring and delivery needs invisible. What I have seen with my own eyes is pregnant people and their spouses being misgendered, having social workers called on them because of their sexuality and the way they've chosen to create family, and generally being dismissive when they are asking questions regarding their health and pregnancy. And this is why LGBTQ people need community health workers and doulas who not only look like us, but also have the same social experiences that we have. Those who have navigated hostile environments and know how to survive within the context of those environments. Those who know how to support us and bring us out on the other side healthy, whole, and most importantly, living. My ask today is that City Council set aside funding for grants to help train Black doulas and health workers, specifically Black doulas and health workers that are willing to work with queer and trans people and community members. So what I'm asking is that you help us help Black mamas, and that you help us survive in hostile environments. Thank you.
Councilmember Williams.
Thank you all for this presentation. A lot of times it's very tough for certain communities to talk about tough situations and when we don't talk about them, it allows them to continue. So I thank you for giving voice to this. Mrs. Greenaway, Nurse Nikki, thank you for what you've started, what you founded here. I mean, just seeing your partners and collaborators, but seeing the support in the room, it speaks volumes. It should not be, you shouldn't have to take a vow of poverty to work to bring life into this world. That should not be the struggle that it is. And when you look at these numbers and you look at the disparity for Black women to every one white woman, and you look at the fact that 45% of these deaths are preventable, you're left with only one conclusion, that the structures that are in place, or the lack of funding that is in place, is simply a vestige of just a brutal way of life and a brutal past in the Deep South, and institutional racism. There's no other explanation for the disparity in these numbers, and equitable Medicaid reimbursement should not be difficult. You know, when you listen to certain conservatives talk about how important life is and how much they love babies, this should not be a struggle, and it should not be a one-sided argument. So I stand with you all to figure out ways that we can have grant funding go your way, and just find funding to go this way, because this work is important. And you know, I think you said it best. And you know, and Women with a Vision have always sort of stood in the gap for people who find themselves marginalized. But doulas really are the only answer, because you're not going to change everybody's mind in every hospital and every pair of scrubs. And at a moment, and of course I can't speak to it, I can't have a baby, but I can't imagine a more vulnerable, more critical time to have someone you trust at your side. So thank you for giving voice to this today, and I stand ready to do whatever I can to help. I will encourage everybody who is listening to this to vote, because this governor's race is going to be a very, very big deal when you start talking about who has access to health care in the state of Louisiana. There's at least one person who does not care whether or not people have access to health care. So thank you all very, very much.
Thank you.
Thank you.
Thank you.
Thank you, Councilmember Williams. Any other council members? I have a public speaking card. Erica Sanchez. Ms. Sanchez, would you please state your name and your address? You have 2 minutes.
My address as well. Hi, I'm Erica Sanchez. I live at 1215 Josephine Street. Good morning, council members.
Good morning.
I hope that each of you sees the number of people that have showed up today to support the women that are in front of you. And a lot of them are wearing shirts that say, "Trust Black women, support Black mothers," things along those lines, right? You guys are going to continue to hear today and over the course of the following months from groups concerned about reproductive health and justice in our city. And I urge you to understand and remember that this is a matter of life and death for Black women and for their families. While we continue to fight for reproductive rights in New Orleans, we have to remember that Black women always bear the brunt of reproductive injustice. I urge you to commit to the health and safety of the Black community of New Orleans by supporting the women who appeared before you today in their continued work. And I want to echo Nurse Nikki's point that every single council member should care about these issues, because every single one of you has constituents affected by these issues. And I want to also repeat that you owe this to the Black mothers of New Orleans. Thank you.
Thank you very much. So, Nurse Nikki, I heard you very clearly and your frustration, and I think we all share it, and definitely the people in the audience. And I always share your sentiment very clearly about it's just a meeting, because I think we all get tired of meetings and then there's no action steps.
Right.
So, I mean, the only thing I can do is tell you after this we will have a meeting, but we'll make sure that we have Dr. Avegno, who is in charge of the health department for the city of New Orleans, in the room with Emily Wolf, who is the mayor's office of families. I think what we should do first is see what we can do for our city workers, and deal with that immediately, right? And then how we can find additional money for doulas. I agree with you. I've seen it firsthand, the importance of doulas and what they do. And I don't think people really understand either the need to have more Black doulas and more Black nurse practitioners as well as doctors. I mean, in this report, it clearly states, and it was shocking, that only 4% and 1% of all people being trained currently in the state of Louisiana for doctors are either Black or Hispanic.
Yes.
And it's disheartening, and we have to start talking about those numbers as well. And all these numbers have a relationship to Black health. and especially when we talk about black women who often have to bear the brunt not just of health decisions, but also of structural racism in terms of taking care of their family, dealing with less pay than men, and also having to take care of so many more people. So when it affects a black family and a black woman, it actually has a multiplier effect when it affects an entire network.
Absolutely.
And we don't talk about that often enough. So we will do that immediately within this next week, and we'll try to get the mayors, people on schedule to deal with that. I would like to lobby with you. I know a lot of these issues for Medicaid reimbursement are at the state level, but I will lend my services. I know Councilman Moreno knows Baton Rouge very well, but we would have to lobby up there at the next session, which I pledge my time and energy to do, to personally go up to Baton Rouge and lobby for that. And let's talk about next steps on how we do that, because it is so cost effective. And, you know, when you look at, and I hear stories about people that I know that had their children in Europe or had their children in the Netherlands, and that they get somebody that comes into their home every week for 6 weeks after their baby is born.
Yes.
They don't have these kinds of numbers because they understand the importance of what happens postpartum, right? And these numbers reflect it. So what you do is so vital, and I will work with you very closely to make sure that we can focus on this.
Thank you. I
Thank
appreciate
you.
that.
And I do ask, I'm going to also give all the council members this report. We'll make sure that this report is circulated. The health of women and girls in Louisiana, the racial disparities in birth outcomes is brutal to read.
And Councilmember, I just wanted to ask, is this in an electronic format that you can send us as well so we can
Yes.
push out on social media? I think a lot of people are going to be shocked when they see these numbers. Some people know it, but there's a lot of people who just, I think Ta-Nehisi Coates was saying this the other day, that certain people are just going to disbelieve anything. No matter
Right.
climate change isn't real, but certain people just, in a vast number, just don't know. And so I think we need to educate the masses so they can find themselves as supporters of this cause.
That's correct. But some people don't know, but once we know, we can't not know.
That's right.
You can't
That's
unsee
absolutely
it.
right.
Can't unsee it. Councilmember Moreno?
Yeah, and Councilmember Palmer, I'd also think we need to have at the table Dr. Rebecca Gee, who is
Yes.
the Secretary of the State Department of Health. And I think that I know that this is something that she is currently working on a new platform, a statewide platform around this. So I definitely want you all at the table so that we can help build this bigger and better. But thank you all so much for what you do. And I know you're in Baton Rouge all the time. All the time. Yeah, so we'll see you up there this session then.
I appreciate your presence. Thank you so much.
You're welcome.
Thank you all.
Thank you all very much for your work. You were awesome. I know. What would I say too?
The second order of business is a presentation. Heidi Winston, founder and volunteers. Courtney Pellegrini, Yvonne Antoine, Evelyn Coffey, Grow Girl magazine. Go Girl is a local nonprofit print and online magazine created for